Peter is a board-certified gynecologist. He was married with 3 children ranging in age from 13 to 26. The eldest daughter who graduated from the Academy of Fine Arts in 2009 is now Peter. Unfortunately, he was in a car accident and must see a doctor. Peter has been seeing a PA for the past 12 years. PAs provide diagnostics and therapeutic patient care in almost all the medical specialties and settings. Anyone who exhibits symptoms of moderate to severe traumatic brain injury should seek medical attention as soon as possible because there is little we can do to reverse the initial brain damage caused by trauma. Medical providers attempt to stabilize a person with TBA and focus on preventing further injury. However, injuries sustained in a car accident such as traumatic brain injuries may take days or weeks to manifest. As a connection to our topic, we must emphasize the presence of TBI that can be acquired in a car accident because our brain uses an average of 140 billion nerve cells known as neurons to control every thoughts and actions, which can have an impact on the things we do every day.
November 1998, the car PA was driving struck a tree when he swerved to avoid a head-on collision, which meant that the front ends of 2 vehicles such as car, trains, ships, or planes hit each other when traveling in opposite direction as opposed to a side collision or rear end collision. Hindi siya bumangga sa kotse pero bumangga siya dun sa puno dahil iniiwasan nga niya yung kotse. He incurred multi-organ injuries. It can be 2 or more organ injured, including a very severe TBI or traumatic brain injury. It is usually result from the violent blow or jolt to the head or body, an object that goes through brain tissue such as bullet or shattered piece of skull. In his case, skull shattered because of the big impact when the car crashed into the tree, and he remained conscious for a short period of time immediately after the accident. However, his memory concerning the event itself seems to be intact as of this writing. Since he got into a car accident, hit his head, cranial hematoma developed. It is a collection of blood within the skull. It is usually caused by a blood vessel that bursts in the brain. It is life-threatening. That's why he lost consciousness immediately since he got into multiple organ injury. He remained in a coma for 63 days, but it is not operated. His post-injury amnesia lasted up to 98 days.
The patient is evidently having a brain structure problem because he is suffering from hemiparesis. It may cause of brain damage due to trauma or head injuries because his muscle is weak. And he's also suffering from narcolepsy. His hemiparesis, it can be connected with inhibitory or the GABA because GABA, it has something to do with sleep paralysis or by not be able moving the body. But in his case, he only can't move the other side of his body. Also, he has visuospatial disorientation. And through this, I can say that he has problems with excitatory or it has to do with memories.
Initial signs of misidentification were observed in February 1999. This included inaccurate spatial orientation with confabulation. Example, the clinic was identified as garage and he was mechanic. Loss of the feeling of personal identity. The patient complained that he did not know who he was despite the absence of objective symptoms of global amnesia. Abrupt changes in personal habits and routines including smoking and drinking. Loss of personal history, social roles, and lifestyle. At the time, he was able to recognize like his name and some of the personal items like the keys, a comb, and toothbrush, but he denied that they belonged to him. So later in his recovery, he was able to know objects relevant to his past like cigarettes, a bottle of cognac, but did not recognize these items as being connected with his previous experiences.
So nagkaroon nga ng pagtatalo yung mag-asawa and PA intended to go to the party with his lover, and after nung matindi na lang pagtatalo ay eventually backed down with his boyfriend's time. However, during the trip, may biglang kakaiba sa takbo ng kalsada, and PA drove into the tree while passing a delivery truck. And ang nangyari, PA take himself the full force of the impact, and yung wife niya hindi naman ganun nagka-injury. And after nga ng aksidente na nangyari, ang cause nga raw ng aksidente ayon sa opinion ng mother niya is yung hysterical behavior ng daughter-in-law niya. And PA is actually driven too much, mahilig magpatakbo ng mabilis and mahilig sa mga sports cars since childhood niya daw. And very significant changes sa behavior niya and habits were noted in the following 6 months after ng coma niya. Bago raw yung aksidente, PA is a vegetarian, a smoker, and a moderate drinker, a known with who enjoys social intercourse and parties. And after ng injury niya ay tila wala na siyang maalala kung ano yung lifestyle niya dati at kung sino ba siya. At the same time, nagpakita siya ng symptoms of mirror sign, and makalipas ng ilang buwan ay Capgras syndrome naman, which included suspicion and confabulation ayon sa kanyang wife and children, whom he called impostors. And tinatanggi niya yung dati niyang lover ni even denial of his dog. And yung dog niya, hindi siya nakakilala nito at tinataw lang pa siya doon. However, facial recognition of public figures was preserved. Below are some examples of the patient's problem.
A psychotherapist named Jacek was helping patient Peter stand in front of a full-length mirror. The therapist asked Peter who's the person standing in front of the mirror. Peter said he didn't even know the person, and he said that a monster was staring at him. However, that person was also Peter. The therapist also asked him, who else did Peter see in the mirror? He answered that he didn't know, but he had a hunch that it was Jacek, the therapist. Although he was not able to recognize himself in the mirror, he recognized and gave the name of the therapist. He also remembered his own name when asked 10 minutes after this incident. However, he did not remember that he had been standing before a mirror or what the therapist's name was.
So, na-assign ako sa part na dinedenay niya yung family niya. Nung tinanong siya kung masaya ba daw siya na nakita niya yung family niya, sinabi niya na hindi daw sila yung totoo niyang pamilya at mga doubles lang daw yung nakita niya or yung nag-visit sa kanya. Ito ay isang case ng Capgras syndrome, which is a syndrome characterized by a false belief that an identical duplicate has replaced someone significant to the patient. Nade-develop ang ganitong klaseng syndrome kapag meron kang dementia or kapag wala naman, makukuha mo ito kapag malakas kang uminom or nagamit ka ng illegal drugs, or kaya naman meron kang health issues like low thyroid, metabolic conditions, or meron kang nutrient deficiency, or kapag mababa ang vitamin B12 mo. This type of syndrome usually nagde-develop siya sa right hemisphere of the brain, which is responsible sa attention, memory, reasoning, and problem solving.
Our actions or how we react is based on the level of our serotonin and dopamine. Why? It is because serotonin regulates our behavior, moods, and thought processes. It is also a neurotransmitter that regulates our sleep pattern, sexuality, appetite, anxiety, and pain. And one of the symptoms that they have noticed during the visit of the former girlfriend of the patient is that the patient was aggressive towards his former girlfriend, and he didn't even recognize the girl. And this happens when there are extremely low activity levels of serotonin. On the other hand, dopamine is responsible for allowing you to feel pleasure, satisfaction, and motivation. After about half an hour when the lover left the patient said to the therapist that his fiancée or something must be somewhere but he doesn't know where she is. And this is where dopamine takes charge. Once dopamine is turned on, other neurotransmitters may then inhibit or facilitate emotions or behavior.
The connection of our topic this week with the case we read is the presence of a psychological disorder due to accidents. Peter A, was involved in a car accident. Then, he hit his head and had a brain injury. Since the accident, his personality has changed. He used to be a dog lover. After the accident, he doesn't like dogs anymore. He seems to hate their fur. When he had a brain injury, his life seemed to change. He became fond of politics after the accident, whereas before he had no interest in politics. Brain injuries can have significant effects on behavior, impacting impulse control and self-awareness. These effects stem from damage to areas of the brain that regulate emotions and impulses and include anger, impulsive behavior, self-centeredness, impaired awareness, and even violence.
A severe traumatic brain injury may bring changes to a person's personality or behavior. It also affects the way that they perceive the reality. So, traumatic brain injury may lead a person to a brain complications like amnesia or an identity crisis. So, in the case study of borrowed identity syndrome, after severe traumatic brain injury, due to the severe traumatic brain injury, the boy loses his identity, memory, and sometimes claim that he is a car mechanic. So this is a case of a identity misidentification. So in our lesson, our brain is not fully intact in our skull, which means that when a person bumps his head, the brain inside also moves, and which causes injury to our brain. So and may damage important parts of our brain like the hippocampus. So as we all know that hippocampus plays an important role in learning and our memory.